Hey friends, welcome back to the Pro-Aging Podcast. We are on Season 3, Episode 4, and I have to say, I've been doing this for a few years. The guest that we got today, I have been begging to get on here since Episode 1, Season 1. He's a colleague, he's a close friend, and I could sit here and go through his extensive resume and his renowned accolades, but the fact of the matter is he is a double board certified facial plastic surgeon, but most importantly, he is my own plastic surgeon. He has not only worked with me on cases each and every day, but he has also worked on my face. So that's not a good introduction for Dr. David Rosenberg. I do not know. You've all heard his name. He works here in New York City with me, and we're going to learn some things about advancements of techniques, how we collaborate with non-invasive procedures and dermatology versus plastic surgery. And we're just going to get it started right here. David, thank you so much for joining me. What are we doing next on my face?
This is an absolute pleasure. I have never done this before.
I know.
Because I just kind of hide, but you're convincing and persistent.
Good.
So, yeah, let's make this happen.
Okay.
What's next for you? We take a pause.
I think it's the neck.
Okay, good. I agree.
We're doing things baby steps here, but yeah, I'll just say 1 or 2 words before we get started, just about how we work together. The first question I have for you, which I think a lot of people have, is, I think there's greater social acceptance of getting surgery now. People used to be embarrassed, like they'll admit getting Botox, but they won't talk about surgery. Now they're getting it done younger. It's much more socially acceptable. Is this a good thing that people getting it done younger? Is there too young? Tell me.
Great question. So we want to discuss surgery as a whole, or are we talking about specific procedures in that question?
Well, like a facelift. Like people getting facelifts done. You hear people like in their late 30s and early 40s. Is earlier always better?
There's this situation that occurs when a patient comes in to see me, which is they sit in the chair and I ask them, how can I help? At that point, they say, I'm bothered by my jawline and my neck, for instance. My job is, do I see what they see and can I give them what they want? When someone comes in and they're in their young 30s and they say, I'm bothered by my neck and my jowls, unless they've had significant weight loss and have gotten really loose, or they have this genetic propensity for really early laxity, there's going to be a lot of situations where I don't see what they see. And I suggest they go and see you.
So is there a certain test that people could do at home, like with their fingers? I see when you examine people, you're testing tension lines. Is there something that people can do? Because, of course, everyone thinks they need surgery when they look in the mirror. But are there certain things when they move their face? Or
That's a great question. So we tend to fall down and in as we age, down and in. So you can take your index finger or your thumb and look at a mirror and see if there's a noticeable difference with that manual elevation. Is there a noticeable
without pulling too much?
It's got to be a soft pull.
It has to be a soft pull. And there are people you turn away.
There's regularly people I turn away. I think the age group where people really start to come to see me is now in the late 30s, early 40s. I start to see people.
That's different. I mean, we've both been doing this for decades. Is the average age of patient now compared to 15 years ago dramatically different?
Undoubtedly. I came out in 2000.
Yeah.
I think the average age for my practice that one is probably 60.
Yeah.
It's really come down. The acceptability, as you mentioned, of undergoing surgery for facial rejuvenation has grown so much, where in the early 2000s, if someone did have surgery, they would be more likely to hunker down for a month.
Yeah.
And then come out and not say a word to their friends. And
now they talk about it.
They will bring a friend in for the consult now.
Yeah.
So they're celebrating it more.
Yeah. And I think it's true in dermatology as well. I mean, people are, if they it's like a form of grooming, a lot of the things I do. And I think, I tell people, it's nice to clean up your room before it gets too dirty. That doesn't mean you need to do a spring cleaning, and it doesn't mean, there's nothing to see in the mirror. You should treat like people come in, they want to do like preventative Botox. I'm like, no, you treat ages when you start noticing the lines. Relative to what you're saying about, you mentioned something about shorter recovery. Do you think the techniques today are safer than they were 20 years ago?
So when we talk about technique, we really have to bring it down to the individual performing the technique.
Right.
So the emphasis on the D-plane facelift has really become evident in the last 5 years. I've been doing this from the get-go, the D-plane facelift. I never marketed it as the D-plane facelift, trying to get the world to get behind that approach. It was what I believed in from the beginning. But now with marketing and education, it is people know about it.
Yeah.
In the right hands, it's remarkably safe. It's aesthetically safe. It guarantees that the patient's going to look like themselves at the end without pleats, without imbalances, as long as it's done well. I don't want to say that surgery is safer because it comes out to the surgeon performance.
Yeah, and also the candidates. I'm assuming, too, if you have younger, healthier patients, that's obviously, it's always good.
So when we talk about safety in terms of medical complications, the advantage of having a 48-year-old versus an 88-year-old on the table is tremendous.
Yeah.
So I get a medical clearance on every single patient beforehand, and thank goodness in 10,000 procedures we've never had a transfer. We're very careful about that. But yes, people come in and say, should I do this? They're 52. Is it better at 52? Or should I wait a decade? I said, well, you're at 52, you're younger, you're healthy, and the material I'm working with is better.
Much better. If you had to explain to the layperson audience what a deep plane facelift, like moving the sheet, moving the thing, people know the name, but like, how would you explain it to the public? Like, what are you doing that makes it look natural?
Okay, so the word deep plane means going deep to the platysma muscle.
Okay.
The platysma muscle is that muscle we can all flex in our necks.
If we're not Botox.
It starts on the clavicle, on the collarbone.
Yeah.
It goes up to the jawline, and it keeps going up halfway to the cheek above the jawline.
Yeah.
We did a study in the mid-2000s where in the operation you see the deep plane approach leading you to the platysma, and you're looking under the platysma, and you see how high it goes in the face. It goes about 4 inches above the jawline. So the deep plane means you're able to go under the muscle in the neck continuously all the way up to under the muscle in the jawline. It's one sheet of muscle you've freed up, and as you slide it back, the skin comes with it. So it's a foundational lift.
Right.
I use the analogy that if you have a carpet and it's nailed to the floor and you want to slide it, you cannot slide it. It's stuck.
No.
The deep plane facelift is like that. You want to slide the muscle in a facelift, but if you don't go under it and free up its deep attachments, you cannot slide it. So you're pulling it under tension otherwise, and that tension communicates imbalances externally. So these other types of facelifts where they say they pull the muscle, but it's not a deep plane facelift, in my opinion, it has the risk of creating pleats and imbalances.
Pull type of.
Yes, because you're pulling the skin tighter.
And what would you say the difference is for the audience, like that platysmoplasty, which is what a lot of other word that people use?
Well, in my mind, a platysmoplasty talks about midline work.
Okay.
It involves an incision under the chin, and you free the skin up, and you're tightening the loose central portion.
Okay.
As people get older, by and large, everyone's neck gets looser. So every one of my facelifts begins with a version of platysmoplasty. The deep plane is then the lateral, the outside part, pulling against the platysmoplasty. So the platysmoplasty sets the middle muscle so that when you pull it, it doesn't slide left or right. It's firmly attached, and it lifts up. The lateral part is lifting up and back. I use the analogy kind of like when you put a cinched sheet on a mattress. You put the first side on, and it's really pretty easy to tuck it under the mattress. But you have to pull pretty hard to get that other side under the corners of the mattress, and then smooth as can be. We set the first side of the muscle in the middle with platysmoplasty. We pull against the muscle with the deep plane, and it creates that architecture, that smoothness of the face and skin that you actually see as you smooth the sheet out on a mattress in the same manner.
It sounds like, and I'm sure every surgeon is different, you're using a combination of things that are from the past that were good and modifying that with the most up-to-date techniques, which would you...
I think that's the best description of what I'm doing. There's parts from 1990, if not earlier, in the middle, and even that has evolved.
Yeah.
And then the deep plate facelift itself came out in 1989-90, but it was a much smaller operation. It was just along the jawline.
Yeah.
And incrementally, some other surgeons were working under the muscle in the neck, but not in the face. And over time, it's been brought together to be a comprehensive muscle lift. And that's called the extended deep plate facelift.
So in terms of, when you say the word comprehensive, I know because obviously in New York City, there are plenty of people who say they're deep plane experts, plenty of people in the country. And there are surgeons that have a tendency, they only want to do overhauls. They want to do everything, even sometimes I find not in the best interest of the patient. They say, oh, you're going to need your eyes done in 5 years anyway, so we might as well do them now.
Yes.
And I think one of the things that we work together with and the type of patients that like to see us is that we realize that this is a long game. It may not ever be your last surgery, and you do things that are necessary because sometimes even if you have the best work done and you do too much at once, it's very noticeable to everybody. And someone would say it's bad work when it's actually excellent work. Talk to me a little bit about how you choose how many procedures to do at once on a patient.
Yes. So the guiding principle in my practice is to help people feel thrilled about their facial appearance. And that is a very personal interaction. I meet this patient and I get to know what is it that's bringing them to see me. There's certain people who are just bothered by their jawline and their loose neck. And even though their brows are descended a little bit and they have subtle changes under their eyes, for instance, it does not begin to bother them.
No.
I am so comfortable with an understated outcome and giving a patient that joy of having a defined neck and jawline and stopping there. Because that person, for instance, goes back to Boston, where they're a little more understated maybe than in New York, and they feel very comfortable. And as you said, yes, they may come back in 3 years and do a little bit more, but it's so scary for them to do any more at that time, I wouldn't even broach the subject. Other people come in and they're so excited to do everything, and they're bothered by their brows, by their eyes, by their droopy tip. And they say, Doc, I have 3 weeks. I don't want to come back again. I'm setting aside this time, and I don't want to have another recovery to think about. Just make it happen. And if I'm able to do these operations that make sense for that patient, and it includes a bunch of different maneuvers, and I can do it in a timely manner, then we do it all at once. So I would say I'll do 4 main operations in a week, I would think.
No.
1 big case a day. Or if it's just a face, I would do 2 that day. I don't think facelift alone is that big.
Yeah.
So I will be happy if I can do all this 7 hours or less. I can get a lot done.
7 hours, yeah.
You can get a lot done. Other surgeons might take 7 hours for the facelift alone.
Yeah.
And so that's time from entering to leaving the room, 7 hours.
And every extra procedure you do, it does add it adds more recovery, it adds more issues. You have to feel the patient. I mean, there are some patients who want injectables, old therapy, Fraxel, lipo, all on the same day. And I know the patient, and I'm like, maybe we should split this up. Whereas another patient I would convince because I've been working with them for a long time. That's the one thing different, I think, about derms and plastics. You uniquely, I think, unlike a lot of plastics, develop longer-term relationships with patients. You're not like one and done. It's rare you're one and done. Whereas for a lot of plastic surgeons, it's like they don't actually get to develop and get to know the aesthetic demeanor of the patient, meaning that if they come back in a few years, they'll know how to go about treating them.
Yeah, that's really true. And I do keep notes on what this person's interests are aesthetically, so that when they come back, we can continue that dialogue. One of the things that I think has really helped the recovery, when we talk about larger surgeries, or even just eyelids or rhinoplasty, you can get a bruise, right? And we work very hard to have a gentle touch. And so much of recovery is just a gentle touch and having a helping patient who's off of blood thinners. But even with all that, one can get a bruise. And when I came out 20 years ago, a dark black bruise under the eyes could last 6 months.
And it can leave pigmentation.
It could. And that is gone because of what we do together.
Yeah, but that's true. Yeah.
The V-beam laser.
It's a perfect example. And if people get post-inflammatory pigmentation or reddened scars, that's where really the collaborative effort really goes back and forth. I tell my patients, like, you and I text every day about different patients. People were referring, people were following up on, people that were concerned or nervous and needed reassurance. I mean, it really is a collaborative effort. You know, it's funny, I've told this to people before. People are like, oh, how do you guys start working together? I always tell the story, you called me up one day, we didn't know each other, and you're like, Frank, you do under eye filler? That was when it was like, wasn't even that common.
Yeah.
It's like, I got a patient for you. I've heard your name before. We both had some patients that we had shared in the earlier days, and like right off, we hit it off. It's interesting how it took a few years to really figure out that the use of lasers post-op really dramatically made a difference for the healing of the patient, and how I think patients really appreciate that collaborative effort from the doctor.
Well, you're very welcoming. When people are recovered, let's just say they come to see me today, it's post-op day 6, and they have a significant bruise. And it's, let's say, move it around a little bit, it's Tuesday, and they're post-op day 6, and they come in and they have bruises on the neck a little bit and under the eyes. I tell them if they get a V-beam laser, they could be out for dinner Friday night. Versus 2 more weeks from now, that's very meaningful for people.
And I usually see them after, usually at about 4 weeks, to look at their scars to see how they're healing. And then they'll want a little Botox after the brow lift, or they'll need a little perioral filler. Because again, I always tell people, they ask me, you're so enthusiastic to send for facelifts and surgery. Their assumption is that dermatologists will be like, you don't need a facelift, I'm going to do only non-invasive. I was like, please, David Rosenberg makes my work look good, and you're going to still need lasers, you're going to still need a little neuromodulator, and even with the best of facelifts, you'll probably still need some perioral volumization. Yes. So it's still, you know, we're on a marathon with these patients. It's not just a one and done type of thing. And let's talk quickly about a controversy. It's been a lot in the media now with the non-invasive procedures in the OR. Okay. Meaning, you know, I think there are a lot of people that are concerned of the abuses of energy-based devices, too much injectables, threads, and how they could ruin the chance of you having a good facelift. We've spoken about this many times. I think in the right hands, in the right amounts, a surgeon of your caliber, I mean, 100% of your patients have had stuff done before they come see you, right?
No question.
Yeah.
So, threads, it's no problem because you take your instrument and pull it out. Mm-hmm. So I don't understand the concern. People benefit from threads. It buys them time. It helps them feel good while they're approaching the idea of having a facelift. So when I go in there and I see threads, I don't have any concern. I'm able to grab it and slide it out in a moment. So that's not an issue for me.
Yeah. And we always melt filler down before they go for surgery. You send them to me a few days before.
Yes.
Are there any particular things with injectables? I know we spoke about Voluma.
So Voluma is this supposed to be a 2-year filler, but it's permanent. We all know that Voluma does not dissolve. And I regularly have patients who say, I always ask every patient, have you had filler? And many will say, no, I've never done it. And I say, well, it looks like you've had filler. They say, no. I go in the operating room and there's filler. And I take video of it now and I show them, but oh my God, I forgot I did it 10 years ago. And it's Voluma. Now I'm able to remove it during the surgery manually. It's not dissolvable. So
it takes a lot, high doses and multiple times. It's not 100%. You could reduce it, but it's not like the other filler.
It's really not. It's very persistent. Yeah. It makes recovering harder under the eyes in particular, because if there's Voluma, it's a water retainer and you get edema, and it's frustrating for people. So I get a little concerned when people have a ton of Voluma in the cheek area that it might create persistent swelling. I explained it to them at the 𝐶 𝐸, and I had a phone call today from a patient who had tremendous Voluma in her face during the surgery. She has longer swelling than most people.
And I believe the filler too, overuse of filler, particularly ones that are very thick and are stretching the skin, post-surgery, they can create irregularities.
Yes.
And I think we discussed this on patients that we share, and I always say to them, so listen, you had an amazing surgery here. We're going to work out the differences in the long term with the damage of the filler that was done in the past. But I usually, in only rare instances, do I use those type of fillers, but I'm also very cautious to do little bits at a time on a patient because any kind of challenge. How about energy-based devices? Do you see problems with scarring?
We thought that certain patients were more difficult to perform the surgery. I mean, the scissor didn't want to go where you wanted to go.
Sculpture could do that too.
Well, and then so you get this idea as a surgeon. Okay, I'm going to ask the patient, did you have some of these radiofrequency devices? No, they didn't. So it wasn't.
Yeah.
It wasn't. You would think it was radiofrequency, and a lot of people who've come through, who I know have had radiofrequency, were not typical.
Yeah.
Acne as a child, bad cystic acne as a child, makes the dissection difficult.
Yeah.
It does. That's worse than any radiofrequency device. Silicone in the face makes dissection difficult.
Yeah.
I have not had a problem that I could say, yes, it's been harder with post-radiofrequency.
Yeah. And again, as an expert surgeon dealing with patients who had the things before, I think it's just important, as I tell people, listen, you've been doing cosmetic things for a while, you're having surgery, make sure that you have your plastic surgeon and your dermatologist have conversations because the patient doesn't even know. And I think that coordination of care and skilled hands, there's no reason why people should have to be afraid of non-invasive procedures.
I agree.
A lot of these patients too, which I think affects surgery, they go for these like mini lifts very young. They're cutting through tissue. They're not doing it the right way like if you're going to do something, you do it right.
So I am a believer in, as I mentioned, the deep plane. So when a person who's on the younger side wants a little bit of a jawline and cheek lift, I will do, someone may call it a mini lift, but it's a mid-face lift. It's working right in here. It's an extremely rapid recovery. Well tolerated in terms of do it on a Monday after dinner, on a Saturday or Sunday.
Is the incision the same? Does it come around?
It doesn't come behind the ear. So it stops at the earlobe. It's in the hair, inside the ear. So with a woman who can wear their hair down, and it's invisible, that healing, meaning where you don't see it anymore, between 3 and 6 weeks.
Does it do anything for the neck?
Not much for the neck.
Not much for the neck.
No.
What about big controversies in my office and another place in the derm world? Filler in the nose. As a rhinoplasty surgeon, an excellent one.
Very masculine.
Yeah. Have you had problems or do you have thoughts on filler in the nose?
So we do not perform any fillers on our office. And I particularly would never personally perform filler in the nose. It's the type of thing that can go, in the right instance, can go really well many thousands of times in a row. But there will be that instant where the injection is done in a way and there's bad luck and the skin of the nose dies. That cannot happen with rhinoplasty. It's a devastating, uncorrectable complication. So I can take someone's nose and reshape it surgically with zero risk of skin death. I personally would never do it.
There are 1 out of 20 or 30 patients that ask for it in my office are good candidates. I will use it sometimes specifically in the midline over the bump. I avoid, unlike a lot of derms and providers, injecting into the cartilage because cartilage, as we know, is not greatly vascularized, doesn't heal well if damaged, and I don't want to create damage. Right, our cartilage degrades, it falls as we get older anyway. You don't want to do it to speed that up. Yeah. So as long as I'm staying over the midline bony surfaces and staying away from the vasculature on the side, at times I will do it, but I just tell people actually there are some patients who have had rhinoplasties, in fact a few of them, and a tiny amount of filler in the right place.
So that is a home run. This is why I think I send it to you.
Yeah.
I'm not feeling that I'm an expert, and I want the patients to have what I consider best on earth. Yeah. It's not my expertise.
Yeah. What about men? Now, men are getting into the plastic surgery game too. They're different animals, so to speak. Guys without any hair. What are some of the challenges that you find with them, or outcomes or techniques that you use?
So the lack of hair is relevant. And I have men with no hair, certainly no hair that's going to camouflage my work undergoing the surgery. Half the operation is the closure in terms of duration of effort. So if a facelift total time is hands moving 3.5 hours, over 1.5 is the meticulous effort to close it perfectly. And the sutures I'm using now to close the skin are made for corneas. They're corneal stitches that I'm using to close the skin. That's how delicate it is.
Wow.
And it's interesting because the smallest stitch that I know of people using, for instance, for the eyelid skin to close, is called a 6-0.
Yeah.
I'm using a 7-0 for the skin around the ear. And as you go from 6 to 7-0, you're 50% narrower in diameter.
Wow.
That's a huge difference, and each little entry makes much less of a bar.
But if someone is bald, or let's say they don't like the word bald, they don't have hair. I mean, you and I have short hair, and like if we did an incision here, what is it that, because a guy with a haircut like ours can't camouflage
So
that?
early on, they're going to see a little pink line.
Yeah.
And in the vast majority of that disappears.
Yeah.
Completely disappears.
So,
Scars are mostly a problem when there's too much tension on. When there's too much tension on the skin that the skin wants to separate. The deplaning, the benefit is you're pulling the muscle. The tension's well below the skin, and the skin lays back right at its edges, so that you don't have that massive separation tension. Scars generally heal beautifully with this. If someone's healing is delayed, or if it's red and raised, send them to you, and you will inject them, or you'll laser them. There's no one, I mean, out of hundreds and hundreds and hundreds, you don't see an issue.
men do have thicker skin.
They do.
Actually, not metaphorically. Women have thicker skin metaphorically. So, and I find, with laser procedures, even lipo, things like that, I actually find they heal quicker in many ways. Are there certain, but dissection may be more difficult than men also.
It is. So men have a beard, and the beard hair follicle has a very robust blood supply. So men's operations tend to be a little more red.
That's bloody.
Yeah, and you definitely worry a little bit more about something happening at night where you have to go back to the operating room for draining some blood collection. That's the frustrating part. But as you're suggesting, the thicker skin means less bruising. The quality of their muscle is so hardy. That pull is really impactful. It makes a big difference in men's necks and jawlines, and it's powerful for them. The men that are coming to me by and large work, and they are very successful, and they want their face to communicate the energy they feel inside. And that's what everything that I do is about, helping the face communicate what you feel inside, bringing the two together. And
So
that means a lot for men.
For the audience, because the second, after how much does it cost, which we don't discuss, the other question is, how much time till I go back to work? How much time before I can go to a personal event? What is the average recovery time you're telling people now? Exercise, back to work, back to social events.
Okay, so let's pick the procedure so I can be very specific.
Neck facelift.
Facelift.
Lower facelift.
A lower facelift is going to be out walking by day 5, no problem. Meaning you can, we're in New York, you can take a 7-mile stroll around Central Park and be completely fine. Out with a girlfriend or guy friend who knows you did it, lunch or dinner, day 6, day 7. If you're from out of town, on an airplane, flying home, day 10. Out for dinner with friends who know you did it, but you want to look really good, 2 weeks. Out to a tremendous social event, but not your kid's wedding, 3 weeks. Your kid's wedding, 8 weeks. Or your wedding.
Interesting.
Yeah.
Well, I will tell you, I see a lot of his patients in 1 week and in 1 month. And, I'm shocked how, in 1 week, sometimes these patients with a little bit of hair that goes down, they're ready to go out.
Yeah.
In fact, they like the little bit of swelling.
Yeah.
But what else can we do?
Exactly.
I mean, it's really unbelievable. But it's always best to prepare people for the worst so we look good in the end. We have dinner regularly with a few of our colleagues, and one of the common conversations is all these patients that are on various peptides and hormone replacement therapy, whether it's for testosterone, growth hormone, the GLP, Ozempic, which is a type of peptide, everyone's losing weight. We've had these discussions before. How do these hormones and peptides affect surgery and their outcome?
Great question. Well, let's start with postmenopausal.
Yeah.
Estrogen, progesterone. Women who are on an estrogen patch, no problem. Estrogen pill, we stop 3 weeks prior to avoid any risk of leg clots. Progesterone safe. Then let's move on to testosterone in women. It's a low-dose testosterone, no problem. Mounjaro, Ozempic, the Ozempics of the world, we stop those 2 weeks prior. They are not safe with anesthesia, so they slow the emptying of the stomach, so that can cause trouble with anesthesia. We do not allow patients to take those medications 2 weeks prior. They begin 1 week after. If someone really is frustrated or scared of that idea of stopping that drug because they've been so successful losing that weight, and it's very meaningful, or they're concerned about regaining the weight, they can go on a short course of amphetamine, like a phenpyramine, and do that up to a few days before surgery. And we'll do that with doctor's guidance. Then we get to the other things you're mentioning. Testosterone in men, high dose testosterone, or human growth hormone. We've had problems with it. It changes the way blood vessels contract. It changes the endothelium of the blood vessel. It changes the size of arteries, so that the patients who I've been operating on, who have been on this and who come in and they're muscular, that muscularity is from working out and the effect of the testosterone, and it greatly increases the risk of bleeding after surgery.
I mean, patients come into my office regularly for laser surgery, vascular lasers, pigmented lesion lasers, men, women who want hormone replacement. I look at their skin. I don't even look in their chart. I said, how long have you been on estrogen patch for? Or how long have you been taking T for? And they look at me, well, how do I know? I said, other than being psychic, you have polyderma, redness in the neck, or you're 60, but you have melasma like a pregnant woman. And it's just funny, people don't realize that, there's always pros and cons to these things. The good news is a skilled dermatologist and surgeon can prepare. It doesn't make you not a candidate, but it makes you have to balance the pros and cons a little different in a candidate for anything, laser surgery, plastic surgery, anything like that, right? So I think that's important. Everyone's so worried about whether their whole therapy or their radio frequency or threads is going to ruin their surgery, but they're not thinking twice about all the peptides and hormones that they're on, which are real medical concerns. In fact, a lot of patients don't admit to being on them, say.
Yes, it's been frustrating in times where after the fact, you learn that they're on all these peptides and some of them cause bleeding.
Yeah.
Yes.
I think another big misconception with patients is that, and this is still true in the facial plastics world and in derm, is that they believe what we do is more changing the way you look rather than restoring the way you look. And we all know that the best work done is the work that you can't tell was done at all.
Perfect.
In fact, I tell people, I don't want you to know what I've done. They'll say, oh, you're putting stuff in so many different places. And I said, I don't treat features, I treat faces.
That's right.
And I think there is an approach that we both take in terms of deciding when to do what, how much to pull, right? I mean, it wouldn't be age appropriate for me to have a 54-year-old man to have the eyes of a 25-year-old man, right? So this brings me a little bit into just using my work that you've done with me over the years as an example of how you're just restoring things along the way. I remember I came to you several years ago and I said, I always really liked my nose. I never had an issue with my nose, but when I smile, now it goes down, right? And what happens is there's a muscle here, right? Our tip goes down, right? And the cartilage grows.
It's a combination. The muscles pulling the tip down. And then we have a link between two cartilages in our nose that's kind of like a lock and key. And that lock and key stretches with light. And as it stretches, the tip falls. So in the operation, you're recreating the support of you.
Yeah.
Not so much in creating that lock and key, but you're using other methods to counteract the elongation of the nose.
And a lot of people don't know that. They think a nose job is like you got a crazy nose and you're just changing it. It brought my nose to exactly to where it was when I was 30. And when I smile, it doesn't change. A perfect example of restoration, not, recreation, so to speak. I came to a few years later. Oh, and by the way, that recovery, you did it on like a Wednesday before Thanksgiving, the tip plasty. I went to work on Monday. Like not a bruise, nothing. Like such an easy procedure as opposed to when you're breaking bone. That's one of the differences, right?
Yeah, I mean, I'm proud to say with gentle technique, you can get people back to work day 6.
Wow.
Yeah, even with the breaking of the bones.
I came to you a few years later, and I thought I needed my eyes done. You did a little bit of your famous, Rosenberg maneuvers here, and you had convinced me that it was actually an endoscopic brow that was better. You actually convinced me I could do your eyes at the same time, but if you do the brow and the eye together, it may feminize you or just look too noticeable to other people. You have to look age appropriate. And I said, well, as long as you maintain me looking better looking than you at all times, you do what's necessary. And that actually may be the reason why you only did one part of the time. I don't know, maybe a personal thing. But talk a little bit about your thought processes, which is a common one in patients.
You walk in and you have this desire for your eyes to look better. And I have to balance the big picture. You have to get back to work at a certain day. You look great already, but there's changes that are subtly, incrementally becoming evident. I am 100% committed to keeping my patients looking like themselves, but better. And so that subtle change to me when you walked in and we did just the brow was powerful enough to get you a few more years and had much less potential for delay recovery.
Again, 5 days is...
Yeah, and so for you, I mean, that was the right maneuver in my mind.
Sometimes you do all at the same time.
I will do a lot
Yeah.
at one time, but those people aren't going back to run a dermatologic practice in 5 days.
Yeah, and it was subtle enough, and you said, I'll see you in 2 years. And guess how long it took for me to come back to you?
Was it 2?
Exactly to the day.
Wow.
I was like, listen, look it. And then you did my uppers and lowers.
Yes.
And again, right? I mean, come on, look at this piece of art right
Yes.
here, people. That was a week recovery.
Yeah.
And I was really grateful. And again, I'm trying to, every 2 years, that's my goal. Let's find out what the next step is. But it really is a long game. People always ask me, I don't know if you get this, they said, well, at what age do I just give this up? Like, I just stopped caring. I just stopped. And I said, you never, as long as you're fortunate enough to be healthy, you will have the blessing of vanity, meaning you'll want to look good when you look in the mirror. I say the last thing a cat does is groom itself before it passes. When a cat stops grooming itself, it's going to go soon. And I think humans, in some way, if you're healthy and you feel good about yourself and you have enough vitality, you don't care about the way you look. We've all had moments in our lives where we just let ourselves go due to emotional stress, physical illness. And it's usually when we have other things going on that we don't care anymore. If we have doctors like us that can provide them safe, realistic, excellent outcomes that keep them looking like themselves. I mean, right, you have some older patients, right? I've got patients in their 90s.
We don't operate on the 90s yet. We'll do low 80s. I'm an extremely healthy individual. It's interesting. I have patients come in, they're having surgery. Uniformly, they're quite nervous. Morning of surgery, they're maybe more than quite nervous.
They call me up the night before.
Right. They're on the edge at times. And I go in the room, and I'm always confident because I wouldn't be doing the surgery if I wasn't confident I could do it beautifully. And I'll often say, listen, I know you're nervous, and you're probably worrying about the wrong things. Let me tell you what to worry about. Don't take aspirin tonight, things like that. And I was like, this is a miracle, because for the whole of human time on Earth, you may get to a point where you really weren't looking well, and it was upsetting to the human.
Yeah.
And nothing could be done. And now you can get decades of feeling great about your appearance. It's a miracle for people.
It really is. People, they complain about the the aging process. I'm like, God, what a blessing. Like we forget that, like even up to 100 years ago, at age 40, the average person like didn't have teeth.
No teeth.
Like no teeth. There was no hair color. There was no deodorant. You stunk. Most people didn't have access to like brushing their teeth and taking baths. When you see television shows a couple hundred years ago, they're all my beautiful hair and makeup with white teeth. It wasn't like that.
Yeah.
And now we have so many medicines to keep us alive into our 8th, 9th decade. Why shouldn't we at least make some effort to have the outside be looking and working as well?
Well, I think that's very valid, and I think so much of what I like to do is not judge it. Meaning some people may wrap guilt into this decision. Oh, I feel guilty about doing this. Well, our role here is to help people feel better about themselves. I never judge anyone for their choice to go through this, because how are we to know when someone's really going to have a better life for it? And who are we to judge that? It's interesting when you touched on earlier this conversation about people doing it young. Sometimes when the young people come in, they're saying their friends say I'm crazy. And I'm saying the 40-something-year-old. That's a strong word to say you're crazy, or the family's very against it. But they do it, and my God, their happy factor skyrockets. So who's to judge any of this? Because none of this was available 30, even 40 years ago. And the quality of the work is so much greater now that it's aesthetically safer. Yeah.
Are there certain, what do you see, other than getting your golf game better and convincing me to come on course with you, are there certain things that you would like to see advance in your field? With I don't know, it could be in pre-op, post-op, intra-op. Is there a vision you have of what you think surgery may be like in another 20 years so I can convince you to still practice?
I will still be practicing.
Good.
Okay. So I will be doing big cases and not many small cases. And I really enjoy those cases that they're that day. It's very impactful to the patient. In my own practice, I have several partners and associates who are performing beautiful surgery now, and I want to expand them.
Your wife, Jessica, amazing ophthalmic plastic.
My wife, the best eye plastic surgeon.
Yeah.
In that.
Dr. Ben Paul, amazing. I've said nose work, amazing hair transplant, amazing surgeon, amazing person.
Ben Paul has been with me a decade. Jessica Latman's been married to me for over 2 decades. And she and Dr. Jessica Latman, Dr. Ben Paul, to perform the most beautiful brow lift, upper eyelid combination anywhere. So when those cases are coming to me now, I'm already sending them to them because they do it so well. And I'm focusing on bigger cases.
And I do the same thing.
Or rhinoplasty. I love the craft. So my goals from the very beginning of my career were to provide 3 things. The most natural, long-lasting result with the shortest recovery time possible. So the ability to provide natural has always been there, but you could think, well, if you do less, it's really natural. But that's not the natural we're talking about. We're talking about making it look incredible and natural and lasting at least a decade. That skill set takes a long time to master. And then we get to that recovery part. How do we get people back in their lives on day 6 after a facelift? There's so much being done now that we didn't do 10 years ago. I'm fascinated by how can we get even better.
That's how I feel. I think the next generation of things, both in derm and plastics, are things to speed healing from a biologic standpoint. Not so much in like the way we do the neck lift or the rhinoplasty or the lipo or the laser resurfacing. Because I think there's just like, you're causing trauma. I mean, this nature of it. But I do believe, and I do believe sometimes even some of the peptides, I think research is being done on it. We know in orthopedics, people who have injuries, they can go on growth hormone for short periods of time and really speed up not only the time of the recovery, but the quality of the healing as well. Yes. And I think there's a lot to be learned because, listen, we're still creating scars. No matter what people say, can you get rid of my scar? I say I can make it much, much better, but I can't guarantee a lot of that has to do with your DNA. Yes. And I think we're going to see some amazing things in regenerative medicine in the next couple of decades. I know for a fact you and I need to be around for it.
Yes.
So I think that's really it. I think, the key is, loving your craft, advancing our field, and most importantly, spectacular collaboration amongst medical professionals. We were out today or last night with a few colleagues. It's just so inspiring to sit amongst people that you would put in their surgical hands for one thing or another, and be able to work with them in the best interest of people that just want to live their best lives.
And yes, it's very important to have the wealth of knowledge at your fingertips of not just your own office, but of multiple offices, shared ideas and thoughts of how to get the patients as good as they possibly can be.
All right, my man. On that note, I want to thank you so much.
Pleasure.
We get to go out to dinner after this.
You can find me on the web at drdavidrosenberg.com or just Google me.
That's not that difficult. Or come to my office. We got plenty of this cards. It's all good. We'll be busy planning my next surgery. Thank you all for joining on season 4. And I hope you enjoy the summer. I'm not sure when this is going to come out. But thanks for joining me. I'll see you soon.